I'm your guide on this journey, and it's a genuine pleasure to have you with us today. We often talk about heart health, joint care, and mental acuity, all pillars of a vibrant life. But today we're going to discuss a topic that's equally important, yet often relegated to the shadows: men's intimate health. Specifically, we're exploring simple daily practices that can profoundly impact a man's comfort, health, and confidence as he ages. This isn't about recapturing youth. It's about embracing the wisdom of our years to live more fully and comfortably in the present. So, grab a cup of coffee, settle in, and let's talk frankly and wisely about a vital aspect of men's wellness. This is a cornerstone of life health after 60s. Part 1. The Art of Gentle Cleansing. Respecting your body's wisdom. Let's begin with the most fundamental practice of all: daily hygiene. Now I know what you might be thinking. I've been washing myself my whole life. What more is there to learn? And you're right. But as our bodies evolve, so too should our methods. The skin of a 65-year-old man is vastly different from that of his 25-year-old self. It's thinner, produces fewer natural oils, and has a more delicate barrier. This is why our first rule is gentle daily cleaning without overdoing it. Think of your skin as a finely woven tapestry built over decades. In our youth, that tapestry was resilient, almost self-repairing. Now it's a precious antique that requires a more considered touch. The harsh antibacterial soaps we might have used after a day of yard work or sports are no longer our allies. Their chemical detergents can strip away the skin's protective mantle, known as the acid mantle, leaving it vulnerable to dryness, irritation, and even fungal infections like jock itch, which can thrive when the natural balance is disrupted. So, what does this gentle cleansing look like in practice? It starts with water. Warm water, not hot. Hot water can be overly aggressive, stripping those essential oils I mentioned. The goal is to cleanse, not to scald. Use your hand or a very soft, clean cloth. The era of the abrasive loofah for this sensitive area is behind us. A soft touch is a sign of respect for the body you inhabit. When it comes to soap, the keywords are mild, unscented, and a pH balanced. Look for products designed for sensitive skin, perhaps even those formulated for babies. These are typically free from the dyes, fragrances, and harsh sulfates that can cause inflammation. You don't need a powerful lather to be clean. A small amount of gentle soap is more than sufficient. And remember, this applies to all men, whether circumcised or not. For uncircumcised men, it's crucial to gently retract the foreskin and clean underneath with the same care, as this area can harbor moisture and bacteria. The final step of this ritual is just as important: rinsing and drying. Ensure you rinse away all traces of soap, as any residue can become an irritant. Then, pat the area dry with a soft, clean towel. Don't rub vigorously. That friction can cause microabrasions on the skin, leading to redness and discomfort. A gentle pat-down is all that's needed. This simple act prevents the damp environment where fungus loves to grow. Adopting this practice isn't just about avoiding discomfort. It's a daily act of mindfulness. It's a moment to connect with your body, to acknowledge its changes with grace, and to provide the care it now requires. It's one of the most foundational senior health tips we can offer, transforming a mundane routine into a ritual of self-respect and well-being. This is a key piece of elderly wisdom for a healthier you. Part 2. The Daily Visual Check. Your first line of defense. Our second principle builds directly on the first. Once you've gently cleansed and dried, take an extra 30 seconds for a daily visual check for any changes. Think of this as being the loyal watchman for your own health. In our 60s, 70s, and beyond, our bodies communicate with us differently. Aches and pains become more frequent, and so can subtle changes on our skin. Being vigilant is not about paranoia. It's about proactive partnership with your body. What are you looking for exactly? You're scanning for anything that wasn't there yesterday, last week, or last month. This includes changes in color, any new red patches, white spots, or unusually dark areas. Look for new moles, bumps, or sores. Is there any swelling? Any rashes or blisters? Pay attention to the texture of the skin. Is it suddenly scaly, flaky, or thickened in one spot? This daily check is your early warning system. Many conditions, from simple fungal infections and contact dermatitis, to more serious issues like sexually transmitted infections. Even in monogamous long-term relationships, some can lay dormant for years. Or, in rare cases, penile cancer. First present as small visual changes. For instance, a small, painless sore that doesn't heal, or a reddish growth, could be an early sign of a problem that needs a doctor's attention. Catching these things early is the entire game. A small fungal infection can be cleared up in days with an over-the-counter cream. But if left unchecked, it can become a painful, persistent problem. More seriously, when something like penile cancer is caught in its earliest stages, treatment is often simpler and far more successful. When it's ignored, the consequences can be devastating. This practice requires good lighting and, for some of us, a helping hand from our reading glasses. Don't be shy about it. This is your health. A small, handheld mirror can also be an invaluable tool to ensure you're seeing every angle. This habit does more than just protect your physical health. It cultivates a sense of ownership and familiarity with your body. It demystifies it. Many men, particularly from generations where such topics were taboo, have spent a lifetime disconnected from this part of themselves. This daily check is a way to reclaim that connection. It says, "This is my body, and I am its caretaker." It's a powerful silent affirmation of self-worth. It's not just a health tip. It's an act of elderly wisdom, a testament to the fact that we are wise enough to pay attention to the details. This is a vital part of the senior wise journey. Part 5 is power of moisturizing, protecting aging skin. Now, let's talk about something many men have never considered: moisturizing. For decades, the cosmetics industry has targeted women with anti-aging creams and lotions. But the biological reality is that male skin ages, too. It thins, loses collagen and elasticity, and becomes significantly drier. This brings us to our third crucial rule: moisturizing to protect aging skin. The skin on this part of the body is already among the most sensitive. As we age, the decrease in natural oil production can lead to a host of uncomfortable issues: itching, flaking, chafing, and even painful cracking. Think about how the skin on your hands or face feels when it gets dry. Now imagine that discomfort in a far more delicate area. It can affect how your clothes feel, your comfort when walking, and your overall sense of well-being. This is where a dedicated moisturizer comes in. And no, I don't mean grabbing the first bottle of scented lotion you see on the drugstore shelf. Just as with soap, the product you choose matters immensely. You need a moisturizer that is fragrance-free, dye-free, and specifically formulated for sensitive skin. Many products contain alcohol, which can be incredibly drying, or perfumes that can act as powerful irritants. Look for ingredients like hyaluronic acid, which helps the skin retain moisture, ceramides, which help restore the skin's natural barrier, or natural soothing ingredients like aloe vera or shea butter. There are even specialized penile health creams on the market, but a high-quality gentle facial or body moisturizer often works just as well. provided it meets the sensitive skin criteria. How do you incorporate this into your routine? The best time is right after your shower, following the gentle cleansing and the visual check we just discussed. After you've patted the area dry, take a small, pea-sized amount of moisturizer and apply it gently to the shaft and scrotum. It's not about using a large quantity. It's about consistent daily application. This simple act does more than just prevent discomfort. It improves the skin's elasticity and resilience. Healthy, moisturized skin is less prone to the friction and chafing that can occur from clothing or daily movement. It helps maintain a healthy appearance and feel, which can be a significant factor in a man's confidence and body image as he ages. This is one of the most overlooked but impactful senior health tips. It's a small investment of time, perhaps 20 seconds a day, that pays huge dividends in comfort and health. It's a practical application of the wisdom that comes with age, knowing that a little prevention is worth a pound of cure, and that caring for every part of our body is essential to our overall quality of life. Embracing this is a true step on your senior wise journey. Part 4, the engine of health, supporting circulation through daily movement. We've focused on the exterior so far, but our next principle goes deeper, right to the very engine of our physical health, the circulatory system. Our fourth rule is supporting circulation through daily movement. This is a piece of advice that benefits every single system in your body, but it has a particularly profound impact on men's intimate health. Healthy blood flow is the lifeblood of function. It's essential for strong erections, for nerve sensation, and for the body's ability to heal itself from minor injuries or irritations. As we get older, our blood vessels can become stiffer and narrower, a condition known as arteriosclerosis. Chronic conditions that are more common in our later years, like high blood pressure, high cholesterol, and diabetes, can further compromise this vital network of arteries and veins. When blood flow to the pelvic region is reduced, the consequences are direct. Erectile dysfunction, or ED, is one of the most well-known. An erection is purely a hydraulic event. It requires a surge of blood to fill the tissues. If the plumbing is clogged or narrowed, the pressure isn't sufficient. But it's not just about erections. Poor circulation can also dull sensation, making physical intimacy less pleasurable, and it can slow down the healing process, meaning a small void or irritation might linger for much longer than it should. So, how do we combat this? The answer is beautifully simple. Move your body every single day. I'm not talking about training for a marathon or lifting heavy weights at the gym unless that's your passion. I'm talking about consistent, moderate movement. A brisk 30-minute walk is one of the most powerful medicines available to us. It gets the heart pumping, encourages blood vessels to remain flexible, and improves circulation from your head to your toes. Think of other gentle activities you enjoy. It could be gardening, dancing with your partner in the living room, swimming or cycling. Even simple stretching or yoga can be incredibly beneficial as it helps improve flexibility and blood flow to the pelvic floor. The key is consistency. A 30-minute walk 7 days a week is far more beneficial than a single, grueling 3-hour workout on a Saturday. This daily movement also helps manage those other health conditions that impact circulation. It helps control blood sugar levels, lowers blood pressure, and can help reduce inflammation throughout the body. It's the ultimate multitasking health strategy. This commitment to daily movement is a commitment to your independence, your vitality, and your intimate health. It's a declaration that you are an active participant in your own aging process. It's one of the most empowering senior health tips because it puts the power directly in your hands, or rather, in your feet. Every step you take is a step towards better health. ensuring the engine of your body keeps running smoothly for years to come. This is a crucial aspect of life health after 60s. Part 5. The final act. Mindful urination and bladder health. Our fifth and final rule addresses a process we perform multiple times a day, yet often with little thought: urination. As we age, this simple biological function can become more complex. This is why our last principle is mindful urination and complete emptying of the bladder. This is a cornerstone of long-term urinary and prostate health. For many older men, the prostate gland, which is about the size of a walnut and surrounds the urethra, naturally enlarges. This condition, known as benign prostatic hyperplasia or BPH, can squeeze the urethra, making it more difficult to start the flow of urine and, crucially, to empty the bladder completely. When even a small amount of urine is consistently left behind, it creates a stagnant pool that is a perfect breeding ground for bacteria. This can lead to painful and recurrent urinary tract infections, UTIs, something many people mistakenly associate only with women. Incomplete emptying also means the bladder is constantly under some degree of pressure, which can lead to feelings of urgency, frequent nighttime trips to the bathroom that disrupt sleep, and, over time, can even stretch and damage the bladder wall itself. So, how do we practice mindful urination? It starts with rejecting the urge to rush. We live in a fast-paced world, but the bathroom should be a place of patience. When you feel the urge to go, don't hurry the process. Take your time. One of the most effective techniques is simply to relax. Tensing your abdominal or pelvic muscles can actually work against you. Take a deep breath and consciously relax your entire pelvic region. Another powerful tip that many men overlook is to try sitting down to urinate instead of standing. This position can naturally help relax the pelvic floor and abdominal muscles, allowing for a more complete and less forceful emptying of the bladder. There's no shame in it. In many cultures, it's the norm for men. Health and comfort should always trump old habits or perceived norms. Another technique is called double voiding. After you finish urinating, remain on the toilet for another 20 to 30 seconds. Then lean forward slightly and try to go again. You might be surprised that a little more urine is released. This simple extra step can make a significant difference in how completely you empty your bladder. Paying attention to this final act of our daily bodily functions is a profound form of self-care. It's about preventing problems before they start. It protects your sleep, your comfort, and the long-term health of your urinary system. It's the kind of practical, grounded elderly wisdom that defines a truly healthy and aware life after 60. It's the final piece of our puzzle for comprehensive life health after meds. So, there we have them. 5 pillars of daily care. Gentle cleansing, a vigilant visual check, protective moisturizing, supporting circulation through movement, and mindful bladder health. As you can see, none of these practices are complicated or time-consuming, but together, they form a powerful ritual of self-respect and proactive wellness. The journey through our later years is not about fighting against time. It's about partnering with it, using the wisdom we've accumulated to live with greater comfort, dignity, and in confidence. These senior health tips aren't about vanity. They are about honoring the wonderful body we have for this incredible journey. They are about ensuring our physical health supports the vibrant, active, and engaged life we want to lead. This is the essence of the Senior Wise journey. Thank you for joining me today. If you found this conversation helpful and want more content dedicated to living your best life after 60, I invite you to become part of our community. Please click that subscribe button, give this video a like if it resonated with you, and share it with a friend or family member who might benefit from this wisdom. Your support helps our community grow, Until next time, stay wise and be well.